Two seconds.
Countdown for over now. The first tip for today, this is going to be an interactive half an hour, by the way, so be warned. If you wouldn't mind putting your hands just above your hips, around about your hips here, and just very slightly arch back a bit. We're just resetting our back. This is particularly useful if you're commuting into London, 2-3 hour trip, or sitting in an event like this. And it gives us a chance to get the technology working as well. Can you hear me? Everybody hear me? Thank you very much. And sit down. So keeping it international, I'm all the way from a country called Wales. We have our headquarters at Nantgarw, which is near Cardiff. And I head a consultancy called Active Ergonomics, which is part of Orangebox. And it was our corporate clients that really triggered this research and observations that I'm going to share with you today. And they were saying, well, there's actually a little bit of a change occurring in the workplace that we're uneasy about, because we've all got used to the display screen equipment regulations about making sure our workstation's set up, but people are bringing in their own equipment. We've got our American cousins who've issued everyone with tablets, and it's coming over the Atlantic. What are we meant to do? And people aren't working at a fixed desk anymore. So what I thought was going to be a sort of 4-page pamphlet giving some advice on mobile technology ended up being a kind of 12-month research topic. And we did think tanks up and down the country with people like yourself. We did interviews. We did a global literature review with the help of University College London and Brunel. And we also did an online survey. And it's fair to say it's still ongoing. And I think we would all agree there's a bit of a perfect storm brewing in terms of the way the workplace is changing. Be it technology, working practices, generationally, it's very difficult to keep up. And I must stress, I'm not a technology Luddite, but just with my ergonomics hat on, I do have a few concerns about us keeping an eye on that pace of change to make sure that we're still productive and we can keep morale and motivation going in our workplace. So for the next half an hour, we're going to explore what's happening out there, what the issues are, and I have to warn you now, it will get depressing for 15, 20 minutes, okay? So in the spirit of networking, you may wish to hold a neighbour's hand, okay? Because it will get a little bit depressing, but there is a happy ending at the end, so we're going to discuss how to improve things as we go along. So I think we're all agreed, and the research suggests that 1/3 of us are working away from a fixed desk, if not the workplace. And that's something to keep an eye on. And the triggers for change are varied. I mean, the obvious one is the technology one. We can work anywhere. Both employers and employees prefer it. There's a perceived improvement in productivity in terms of flexibility. Reliable broadband, more women in the workplace, shift from manufacturing to service, and generational changes as well. And we've been talking about boomers and millennials for the last 5, 10 years. And if you haven't heard of them, can I introduce you to Generation Z? Born roughly the year 2000 onwards, and they're making their first tentative steps into the workplace. And they've been immersed in technology from birth. You can see that when you go shopping and you see children trying to expand televisions and expand comics that they're reading. It's blurred between using a tablet and any other reading material. In terms of technology and what's happened in the workplace, I mean, we certainly know, if we think, for example, just agglomerations, huddles of like-minded businesses. We've got an ancient one here in the city with a finance group, but there's a new one emerging in King's Cross, and Google will be at the centre of that, the TMT, technology, telecoms, media industry. You know, 1/3 of people in the southeast are involved in that, and 1 in 10 people in London are involved in that business. We've got rented spaces. I mean, who would have thought 4 years ago there was only 75 co-working spaces in the States, and there's now over 3,000. In the regions, maybe it's not so familiar with co-working, but certainly hotels on their ground floor are looking at spaces very differently in terms of co-working. We might even have a rebirth of the regional high streets in terms of spaces where people can work. And then we've got accessible online education, the MOOCs, you know, this mass open online communication. So we can't really advise our children in the way that we started work, because the competition is actually global. You can You can bring in talent from all over the world because of online education. I think we're more aware generationally as well of the talent that we might be losing from the boomers and the new talent bringing new ideas into the workplace. And it's just getting us more aware of that. In terms of devices, we're carrying, on average, 3 devices each. We've got perhaps our desktop, we've certainly got our laptop and our smartphone, and we might have a tablet. These things are all buzzing and pinging away at us all day long. Do you brush your teeth first, or do you check your mail? Sadly, I check my mail. I've really got to get an alarm clock for Christmas, because I put my stupid phone, and it's kind of vibrating and buzzing by my bed. That's something I must remember. And when we did our think tanks, most people admitted they take their tablet to bed with them. We'll come back to that later. In terms of our Generation Z friends, there will be one-to-one tablet use in schools globally. India are developing their own version of a tablet. Turkey have already got rid of their textbooks. Italy are doing the same thing. There's been 20 or 30 studies in the UK. I'm not sure the Department for Education are keeping up with this. Certainly it's happening in primary schools, and there's been quite a bit of research. Everyone's excited about the fact that, you know, it's great for teachers because they can do all the work online. The parents can tune in and see how the children are getting on. The children are already very familiar with it, more so than the parents. But not one study has looked at the health implications of tablet use. And when you think you've got 11 to 18-year-olds sharing one plastic chair, that's their workspace, of course we can get away with that because children are classed as visitors when they come into schools. If we had that same environment in work, there'd be a mass walkout. So we just need to sort of think about the impact of this, because these people are starting work soon. Of course, we've got emerging technology trends, social media in the workplace, you know, versions of Facebook in the corporate organizations. We've got wearable technology, which started in the fitness industry, but is perhaps coming into the workplace now, and wireless charging. Now, all of this technology is quite small, and it means that there's going to be a little bit more speech recognition to drive this technology. And the workforce itself is changing. We're ethnically more diverse than we were before. We're getting taller and we're getting bigger. We're 11 centimetres taller than our ancestors 100 years ago. So if conversation dries up at the weekend, that's something to talk about at the breakfast table. And it's mainly in the lower leg, just so that you know. We're certainly getting bigger. We know 50% of us are bigger, are classed as overweight, and by 2050, if those trends continue, it'll be 50% obese. 25% of children are in that category as well. And those trends aren't reversing at the moment. There's a lot of talk about it. So as designers, we've got to keep pace of this. One of the things I do is sit on European standards meetings, and you know, dimensionally, we're rewriting the standards the whole time, and we're rewriting the testing standards because it's a moving target. And of course, with the pension age changing, there's more grey people in the workforce. 12% in the UK are 65 and over. We have to design for people of different, you know, quite rightly, different mobility. And disability and accessibility, the definitions have broadened. You know, whether you suffer from migraines or back pain or dyslexia. And students are now far more switched onto this because they get a grant from the government to help with their studies. So they're coming into the workplace with perhaps special BYOD to assist them, and they're far more switched on. Now, the average you know, organisation may not be ready for that, and we have to think about these things. So is technology helping or hindering productivity? It's certainly true that having a flexible workforce really does help. There's a great long list for both employees and employers. The employees like it because they actually get more hours out of people. In the UK, I think we're owed something like 40 days unpaid overtime. We're working the most in Europe. And they can attract a lot of talent by advertising the flexi working. And of course, from an employee perspective, you can get rid of the commuting time across cities like London. You might be at your best later on in the day. It might simply be that you're so distracted at work, you need to pick up most of your activities at night time, because that's the only time you're not distracted. But there are rules and etiquette that we have to think about if we're going to have a more flexible workplace. And of course, we've been getting excited about working away from the workplace, but some organisations are doing the reverse. Yahoo, a couple of years ago, made the sort of unpopular statement that they wanted everyone back again, and they started quoting the stuff we were talking about 20 years ago that Knoll and IBM and others were saying. Informal collaboration, face-to-face conversation is actually what we want. And Google, with their new headquarters, everyone's going to have bike parks and showers and lots of incentives to keep people together and actually get that face-to-face collaboration. Some companies went a little bit too far over the last 10 years and sold half their real estate, and they can't fit everyone back in again. But that's something else to think about. You know, Gensler, in their 2013 survey, said, you know, this is fantastic. Everyone's coming back in and we're all collaborating. But they observed that actually it's getting a little bit noisy now that we're all back in the workplace and we're encouraging this collaboration. There's a lot of gabbling going on and people can't find somewhere quiet to work. If you sit at a fixed desk, you may as well wave a flag saying, come and interrupt me. Or you may have some kind of nice, funky breakout area to work to, and you still get interrupted. But where are the quiet zones where you can actually get on with that quote or get on with that work without being interrupted? I mentioned the wearable technology. But with all this gabbling and noise, I think the furniture industry is guilty of doing a bit of what we did 10 years ago with the subject of green furniture. There's a little bit of noise washing going on. So we talk about decibels. I'm not really sure what we're talking about. I'm interested in the psychology of noise because it's one thing working in a coffee shop when all the babble around you doesn't really mean a lot to you. You can actually carry on and work. But if the babble is relevant to you in a workspace and you hear something that's pricking your ears up, you get distracted. And of course, it's getting louder with all the wearable technology coming in. So there's actually quite a racket going on in the workplace, and that's something we have to be mindful of. Now, I said it was going to be a little bit interactive. Would you mind humouring me? You don't have to stand up for this bit, but could you all just put your arms out like this while I describe some of the health issues? If you just put your hands out like this, you are allowed to wiggle your fingers, but just keep them out while I explain some of the new issues associated with mobile technology. iPad neck is a recognised condition. 1 in 10 visits to GPs, keep those arms up. 1 in 10 visits to the GP is a mobile technology-related ailment. Children with arthritic conditions you don't normally expect with young people are normally associated with older people from gaming and repetitive injuries. BlackBerry thumb. All of these things are just creeping into the workplace now. Anyone feeling any tension in the shoulders yet or the neck yet? Can you go on for another 4 hours? Probably not, and relax. I've just reminded you then of the good old-fashioned occupational health illness that us ergonomists were very comfortable with. It was when you put your keyboard out here and you put your paperwork there and you work like this for your whole career. And then we would come along and say, actually, you know, maybe you bring things closer to you, maybe you can adjust your chair. It actually operates in lots of different ways. And we're getting quite pleased, actually, with this mobile technology. We can say goodbye to some of those ailments, sitting at a fixed desk for your whole career. We can move around and we can be more agile. Fantastic. But actually, we've got some different symptoms from this new technology. I haven't mentioned eyesight, but there's a few conditions here. A form of repetitive strain injury for the eye muscles is called computer vision syndrome. We, for some reason, hold our tablets 10 centimeters closer to us than a book, and we don't blink. And we have something called dry eye syndrome, where you get itchy eyes. And cyber sickness, because we're moving around and probably texting while we're walking and various other things, your muscles are telling your brain that you're on a cross-channel ferry job. And a lot of people are feeling a little bit sick from that situation. And you'll notice on the latest tablets, for example, the background is moving quicker than the icons in the foreground. That's to combat cyber sickness. So you have a sense of infinity and a three-dimensional effect going on. And it's set to rise. While we've got 30% of children owning their own tablets under the age of 8, and surveys in schools where teachers are saying, yes, 60% of my teenagers are sleep deprived, and 40% of the primary school children are sleep deprived. Do you remember the 2012 Olympics and the legacy we were all told about? Well, the Youth Sport Trust did a survey recently, and 30% of schools still don't get PE. They're not doing sufficient PE. So all of these things are just around the corner in terms of you know, our new bright young people that we're employing in the workplace. And I have to say, as ergonomists, we're not always particularly good at training. So we've got this misfit that's going on, and the guidelines are struggling to keep up. I'll touch on it very briefly. If you want to get people away from the desk, just remind them, particularly the ones that like to eat sandwiches at the keyboard, there are something like 400 more bacteria, types of bacteria, lurking on your average keyboard than there are your average toilet. Which did a survey recently, and they swabbed everything, and of the 40 keyboards, 38 of them had to be cleaned, and 3 of them had to be destroyed because they were that contaminated. So, you know, I know it's a bit of a scare tactic, but just to get people away from their, you know, their keyboard at lunchtime, you might get them thinking about that. So I've been interested in the physical side, and that, you know, ergonomics is traditionally the physical side. And can I have a show of hands for people who've had maybe back pain, shoulder, neck discomfort in the last 2 or 3 years? Can I have just a quick show of hands? That reflects the national average, probably about 40, 50 of you. It's the #1 reason why you might be off work. Can I have a show of hands for those of you who've experienced stress and maybe had a little bit of time off work with stress in the last 2 or 3 years? Okay, or have experienced it even if they haven't been off work. Can I have a show of hands for that? Some of you, I think you're being a little bit coy because that is the #1 reason why people are off work for any length of time. And stress is as much a concern as the physical side as well. And when you think about some of the things that are going on in the workplace, we need to be mindful of it. There's me saying, let's all work from home, we can feel more relaxed and we're in control of our job. But some of the research is suggesting that people feel a bit uncomfortable at home. They do feel a bit left out. They might not get the promotions that they're hoping for by being at home. There is a little bit of mistrust with their colleagues at work. You know, what's he doing at home? Did you see that extension go up last week? Well, but he's not working. You know, there's all of that sort of stuff goes on. And unfortunately, some of the surveys are suggesting there is a bit of mistrust. We want to be in work some of the time to show our face to make sure we're not leaving anything out. And while we've got all these devices pinging and clicking away, we don't know when to stop. We're switched on the whole time. You can't put an out of office on these days because you're expected, particularly international companies, to be switched on all day long. I told you it was a bit depressing, this bit. But we all know what happens if stress gets out of control, and it's very difficult to turn the situation around. So we're going to talk about preventative measures now, but just as a quick aside, I went backpacking 20 years ago, and this character had a brick making. He was hand making bricks in India, and he had a perfect sit-stand workstation that he'd carved out of the mud bank. The BBC have discovered this recently. We've got a very good speaker talking about standing at work. He was doing it 20 years ago. His mates were squatting and doing it. He was standing, elbow 50 millimeters above his clay platform, and he was banging those bricks out, and I'm sure he still is. And his friend was doing a good job on the manual handling front, bent knees. He's got 16 bricks to go on his head before he goes off. But I was reminded of that slide on a co-working mobile environment, sorry, train, we used to call them, from Swansea to London. And this character had plenty of seats that he could have sat at, but he preferred to do the standing. He used the luggage rack as a temporary platform. It's quite interesting that if we observe humans, we have a way of adapting to the environment. Here's a teenage workstation. It looks perfectly innocent. But if there's any osteopaths in the room, turn that image at 90 degrees, and it's a nightmare and wouldn't be allowed in the office. The amount of flexion in that girl's neck, and she's going to be working in that position for, I don't know, half an hour, 2 hours. And the entertainment centres, or bedrooms we used to call them, of course, they're completely sleep deprived. You know, their best friends are online. Their mate's in Brazil and he doesn't get up till 3 a.m. so they can share that computer game. 2 of these children are mine, and I watched them run around the house, waiting, trying to find somewhere to park the tablet, and they found their own workstation for hands-free viewing, which was the stairs. Finn's in trouble, but the rest of them enjoyed that program for half an hour. So the good news is, I don't know where our HR person is. Is she still here? We have got absenteeism down, And traditionally, we measure it, in that sense. We're down to 7 days. Four days on average per year, which is fantastic. But if you haven't heard of it, I want us to think more about presenteeism. In its worst case, it's people who drag themselves into work with a shocking cold and sneeze over everybody. But it might simply be people who are disengaged. What are we going to do about the army of people that aren't quite performing at their best? And there are some things that sound obvious that we can do at a base level in terms of a sense of purpose, values centered around trust, allowing some personal control. And I think the millennials do have a good attitude towards health. We can see it with the jogging and the cycling in London. But if you ask someone like me to fill in a survey about my health practices, I'll tell you that I play five-a-side football, unless my wife's within earshot, and she reminds me I haven't played since 2001. I couldn't remember that. Bristol University tracked 1,500 people for a year who filled in these surveys, but they tracked them with these accelerometers, and they had staggeringly low levels of physical activity in the workplace. People might come to me thinking they're going to get a new special chair, and we have a conversation about the steps they take. And they're something like 1,000 or 2,000 steps a day, when they should have a minimum of 6,000 steps a day. But well-being programs are an absolute no-brainer. They save us money. Every pound you invest in well-being practices, if you do it correctly, you get £3 back. And the corporates are waking up to this, quite rightly. The government are also waking up to it, because the NHS is full. They can't do any more. They need corporates to think about being guardians of health so that we can be more preventative, so that we don't just burn ourselves out and go to the doctor when we're broken. You don't thrash a car, you go and have regular MOTs. Why shouldn't we have health MOTs for workers and work on the preventative stuff? Why shouldn't we be integrating some of this? So the government are doing some various things, pledges and charters that you can learn more about in our research document if you want to pick one up afterwards. And you can actually get another day off the absenteeism by the cycle to work scheme. So if we think we've done our job, we've got it down to 4 days, you could probably get another day off by encouraging more cycling to work. Am I going the right way? Have I shown you that slide? And there are companies out there, and you may well be amongst them, that are actually doing proactive things, so that at the bronze level, you're doing the basics in terms of, initiatives to do with smoking and alcohol and back pain, and then at a silver level, you're being more proactive. And I don't mean just a bowl of fruit now and again. It's gym membership, it's integrating health into the workplace, and at a gold level, it's corporate social responsibility and getting everybody involved in it. I'm interested in this model, and I put my hands up involved in health and safety, that we have been guilty of pointing people in the wrong direction. I know it sounds a bit sort of extreme, premature death, but we're looking out for symptoms. Has someone got back pain yet? All right, yes, let's throw a load of equipment at them. Anyone else got a problem? And we're pointing them in the wrong direction. How about, rather than them getting to a neutral point where they're slightly disengaged and they just can't be bothered to tell you about it, that we point them to high levels of wellness? That each year we actually have, as part of their personal objectives, a health one as well, so that we can get them ending the week more invigorated rather than burnt out, and at the end of the 12-month period, more invigorated, feeling healthy. And we're reminded by the business in the community model that it's a partnership between employees and employers. We've got a responsibility as designers to get the workplace feeling and looking fantastic, better physical and psychological health, better work environments, better relationships, and better specialist support. But employees have a part to play as well in terms of their attitude towards learning, connecting with others, giving and volunteering, and taking notice. Humour's a serious subject now. There are consultants in humour, and it's a sad fact that, according to some research, that only 15% of people get sacked because of incompetence. The other 85% get sacked because they don't fit in, they can't communicate. And humour can help turn that round, can help break down some of those barriers. there's a Chilean psychologist who developed something called the Lasada line. I think we can all relate to this. Every 3 positive comments made in an organisation can be wiped out by 1 negative. We all know we've got someone in a department that's a bit negative and it's infectious and it brings everybody else down. So we must take them out and shoot them. No, that's not right. We must nip it in the bud in terms of what those problems are. Then, there's no smoke without fire. There may be a genuine reason why they've got some complaints, and sort them out before they infect others. The sad thing is we should aim for 6 to 1 in terms of positive to negative comments, and it's 1 to 10 the other way in Britain. We're a miserable lot. Training and communication. We're quite bad at that. And if you remember Columbo, those of you who are old enough, he talked about capability, motivation, and opportunity with his suspects. And the point here is training should be delivered in lots of different ways. I was involved in some training 15 years ago, and we had Birmingham University track it. And we were very excited because we had Alexander Technique teachers, myself, and physios training people on chair setup. And we thought, this is fantastic. We'll go and visit them in 6 months and see how well they're doing, and then we'll publish it. We went back in 6 months. 80% of the people had their chairs locked, and 15% couldn't even remember us. So, of course, we didn't publish the results, but we did learn from it. The point was it should be varied, and it should be sponsored from the top. If not, the top should be part of the training process. So you've got the permission, you've got the motivation, the opportunity is allowing that training to occur at all times of the day and in different formats, and the capability. Have something to take away that you can use. And the interesting fact is, if we just got everybody touch typing, for example, we wouldn't have half the postural and backache problems we've got in the workplace. Because instead of people working like this, they'd have everything close to them and they can just be working like this. Something to think about with youngsters being introduced to computers. And that will change behaviour. Ergonomists like their checklists, and we think we've done our job if nobody dies, Is it safe? Has anyone been injured? Great. Well, actually, how about the emotional side, which the designers are out there amongst you are very good at? Hedonomics, the pleasurable experience, the feedback you get from design, and the individualization of it. We know when I graduated from Trent Poly, there wasn't IKEA. For some reason, you inherited your parents' sofa. There was no design domestically. And now, young people are very switched on, because of Apple, because of IKEA and other organisations. Human-centred design, the work of Jeremy Meyerson at the Hamlin Institute and others. There's a whole goldmine of stuff on the behavioural sciences, the psychology of design, which we should pay attention to, because there's a lot out there that we can do to improve the workspace. And you can get it wrong. This purple sofa syndrome, where you put a purple sofa at the bottom of the stairs and you think you've done collaborative working. No one wants to sit there. You feel a prat, and you're not sure whether you've got permission, and it's noisy. So let's think about how these things are done. And fitness approach to design has actually been around for a long time. The Scandinavians have standing up meetings. Thanks to the teacher unions, actually, children go through education on sit-stand desks, because the teachers don't want to bend down and get back pain. But it means their meetings are very effective and take 10 minutes. In our country, we like to book a room for 3 hours, bed in with a coffee and biscuits and have a good old natter and regroup the next month. We've forgotten what we've talked about the first time. No one's taken any minutes. And so it goes on. So I hope I've opened your eyes to the idea that ergonomics can be a bit of a predictive tool. And we think keeping an eye on the changing work culture, the user population and the impact of technology can help us in terms of the design of future workspaces. And we like our buzzwords at Orangebox, and we talk about wireless well working. That's the utopian thing that we're aiming for. And we think there's 4 cornerstones to this. There's changes in policy and making use of it, education, research and development, and also the environment. Put it another way, these circles of influences start with the individual. Mobile technology guidelines are very simple to develop and issue to everybody. Because if you are going away from this and thinking, well, what's the answer? Is mobile technology bad for you? Without being cynical, it is actually killing people. the fatalities, pedestrian fatalities in London have gone through the roof because people are actually texting and getting mown over by buses, and they're falling down manhole covers. And in the States, teenagers, 11 a day, are dying while they're texting and driving. Something like 10 million car accidents a year extra due to mobile technology. So I'm being a bit silly here, but it could kill you. But my point is, let's be proactive. Let's think about revisiting the company policy and also making use of the government policy. Now, I did this work with somebody called Professor Patrick Jordan, who's a psychologist, and he talks about the 4 pleasure fundamentals. You can apply this to your own job design or to the business in terms of the physiological, psychological, sociological, and ideological relationships. We've got our version of task analysis because when we are thinking about space planning, how do you actually make use of the space if we're not going to be at a fixed desk anymore? We talk about the 7 C's, and you can identify different departments and what they do to give you more confidence in how you place stuff. And fitness-centered design, I'm very passionate about. Environments and products and the way we work, so that once we've interacted with these things, we feel better than when we started. Now, I do have something final thing I want to share with you, which is a bit of a breakthrough. And I'd like to ask those of you who were born after 1975 to take a shoe off. Could you take a shoe off, please? And I'll tell you, because I've got a groundbreaking piece of technology here that I want to share with you lot. And it replaces the email. It's called Walkie Talkie. It's completely wireless, okay? It's battery-free. It comes in different colors. It's fantastic ergonomics. It fits everybody. You can have it in different sizes. And the idea is, if you've got a colleague within walking distance, you put these things on your feet and you walk to them and you have a conversation. And I will guarantee you my FQS warranty. You're fitter as a result of it. You get your steps in, which is great. That's a good tick. It's quicker because you haven't had email ping pong for 4 days, copying more and more irrelevant people. And then you think, sod it, I'm going to have to talk to them anyway because it's got out of hand. And it's slicker because guess what? You might bump into someone on the way and solve a problem you weren't expecting to. The FQS. I should get involved with Clark, shouldn't I? That could be. So just remember that. That's a little innovation. Personal responsibility. We've got something called Happy. It's basically, a personal idea of you taking responsibility and making sure you connect with others to make a difference to your own well-being. And I'll leave you with a kind of 10-point manifesto. I don't know how I'm doing for time. We're pretty there. Okay. So if the corporate organizations can think about the well-being policy, revisit that, well-being management, analysis of people, the specification in education, and I think those of us involved in design and ergonomics need to get a little bit more boisterous and gobby about things like data sharing, because the clothing community, for example, have anthropometric data, okay, because they've got so many returns from online shopping because we've changed size. They won't share it with anyone. Let's get them sharing it so that we can deploy that in office design. Let's think about fitness-centered design. We were expecting a DSE replacement last year on their 20th anniversary. They've bottled it. Well, what's going to come in its place? In the meantime, we've got these mobile guidelines, IT health codes for children and parents, and more research. And we've recently done something with UCL on tablet use in children. We can get started now. There are things out there. If you come in the coffee break, we've got some information we can help you with in a pod in the corner. This isn't just about staying, keeping people in work. It's about us being a bit more competitive and agile and getting people more motivated. And for those who didn't believe me about children being immersed in technology, you can buy a potty with a tablet holder right now. I don't know how long Barack spends on his tablet, but children, right now, there's lots of different gizmos you can have. We were after a caption. The best one I've come up with so far from a member of the audience was I poo. Thank you very much.
Jim, thank you very much indeed. Thank you, Jim. Great stuff.
Thank you.